is coming up. And I kind of just wanted to introduce myself, what Mendal Academy is, and then we'll jump right into the webinar. So just an introduction, my name is Gargi. I'm the Business Management and Strategy Officer at Mendel. A little bit about Mendal Academy. We aspire to give success to our students and basically ensure that we guide your hand through the USMLE process as well as the medical entrance exams. So I would just like to welcome you and hand it over to Dr. Mangoli. Welcome.
Yeah, thank you, Gargi. Should we begin, Hari?
Yeah, we have 20, sir. We can get started because we will not have much time towards the end.
Don't have much time
Yeah.
to let them join on the go. All right, guys. So you want to become an expert test taker, don't you? You know there has been this change with step 1. You will no longer be tortured with any scores. But the point is that at the back end, they will be scoring you. So you need to do well in step 1. And also because the foundations that you lay for yourself in step 1 are going to be useful throughout your step 2 and step 3 exams. And then of course, during your residency programs as well as your practice. So don't take step 1 lightly is my advice number 1. If you are, is there anybody who is appearing for step 2 CK in this group right now? I don't think so. But if everyone is for step 1, then this is my advice. So don't take it lightly just because it's a pass-fail kind of exam. So very briefly, I'm not going to go into all the details, and I'm sure you would have browsed the USMLE website. So there are these 3 steps. Step 1 is all about mechanisms, if you ask me. And when we say mechanisms, they are going to telescope into the clinical arenas as well when you get into internal medicine and surgery and obstetric gynec next year. But right now, the focus is going to be on the basic sciences and the mechanisms of action, the physiology part, the pathophysiology, the mechanisms of action of drugs, the mechanisms of adverse events, and so on. Step 2 will test your clinical knowledge, and then you also have to give the occupational English test, which has replaced the step 2 CS. And then, of course, step 3 will be more about patient management and actual genuine clinical problem solving. You know, it's an MCQ format where you will have to pick one answer. You should know that there will only be one correct answer. So there will be no ambiguity and there will be no confusion. There will be one answer which will be superior to the rest of them. So you have to pick that one. Now, before we dive into the actual process of how you can become a good test taker, I would like to take this opportunity and announce our upcoming program, which is called as the Super HIT. HIT standing for high intensity training, because it will be a 4-hour session almost every day, in which I will cover all the 6 subjects that are there for step 1. Now you have, if you want to enroll, if you decide to enroll after this event, you have 2 options. One is that you can enroll for individual subjects, or you can buy the entire bundle, which is called as the Super HIT bundle, which I would recommend if at all you want to buy, simply because you'll be saving a lot of money, around 40,000 straight away. And then at the end of this webinar, I will also show you a promo code which you can use when you sign up for this program, and that will give you an additional discount of a whopping 10,000 rupees. So you will actually save like 50,000 rupees, a very big amount, if you buy the entire super hit bundle. Okay. So in our super hit, it's going to be high intensity. So we are going to, I'm going to cover like more than 8,000 high yield concepts. I'll be covering more than 10,000 high yield MCQs, all USMLE style. Then I have developed some hand-drawn sketch notes. They are a combination of sketches as well as notes, which will help you to do your spaced repetition or a quick review of all the topics. I'll show you some examples of what I have done. There will be lots of self-assessment tests. Somebody raised, and then we will be doing, you will get a graph where you will get to know what are the weak subjects and the strong subjects, a performance analysis. Plus, we will be having image quizzes, because many students complain about being weak in histology and radiology and ECGs and all those kind of things. Then there are certain difficult topics which I will list as we go along, and I conduct separate webinars on those as well. Plus at the end, we will have rapid review sessions. So this was just a brief thing. We'll come to it later on. Let's dive into the topic proper. We are going to tell you some time-tested, fail-proof strategies to become an expert test taker. Now, this information that I'm going to give you is based on my own experience as a teacher, and also the feedback that I get from the students who eventually match into good programs, residency programs. I'm sure you must have visited our website, where I have posted some good testimonials of students who have matched into good programs. So the reason I wanted to do this webinar today about being a good test taker is, there is a common methodology by which students study, and they try to get hold of a study partner. I don't know how many of you do that, are already doing that. I have no idea. But it's a good idea if you have a study buddy where you discuss difficult topics and you bounce ideas off of each other every day. You fix 1 hour in the evening. You study by yourselves most of the time, but you decide that 6 to 7 p.m. is the time when we'll discuss topics on, say, biochemistry or whatever topic you decide to discuss. So the point is, when you study together, and by the time you go to exam, both of you are equally well prepared. But what happens is, one out of the two gets a score of like 250, and the other one drops down to like 210, although both of them are equally prepared on exam day. So what is the difference between the one who gets 250 versus the other one who gets 210? Now, the one who gets 250 is basically what we call as an expert test taker. And becoming an expert test taker is all about strategy. It's all about practice. It's all about perseverance, discipline, following a timetable, and so many other things. It's not something genetic. It's not that if somebody is born with a good test taking strategy, it can be cultivated. So this is what I call as the study buddy syndrome, because some are good test takers, some are not, although they study exactly the same way. And then one of the other problems why good students, I mean intelligent students, every medical student is intelligent as a baseline concept, but they falter because they get carried away by some wrong information given by their so-called best friends. So this is a feedback I have received from some of my students themselves, where they say that, okay, you are doomed if you don't do UWorld 5 times. Or somebody says you just cannot pass unless you do Anki 3 times. I learned first aid 6 times and scored 250 plus. You should do at least 4 different Q banks. I'm sure you have been hearing all these kind of things. You should bunk medical school and just focus on USMLE prep. You should never seek mentors to guide you, because you will definitely fail. Now, my thing is that you should not succumb to such peer pressure, because it does freak out many students, and they do call me up and ask, sir, this person is saying that some rule has changed. Somebody is doing UWorld 5 times. I have done it only once, and that too, I have like 1,000 questions left. Will I pass? Should I change my exam date? And so on. So you are your own judge. You know your own psychology best. So follow your instinct, trust yourself, and put confidence in yourself. Don't succumb to peer pressure. Now, it's good we have students from first MBBS right up to post interns today. And this applies more to the early starters who are in first MBBS. They're very keen to get off the blocks. So start early, it's a good idea, but where to start is always a problem, because I just got an inquiry from a first year MBBS student who was asking me about Kaplan as a resource. Is Kaplan good for beginning USMLE prep? I am a first year MBBS student. I have a very clear-cut idea about opinion about this part. You should begin from your medical school itself, which means you should master the basics in medical school through textbooks and teachers. Don't be in a hurry to jump to USMLE resources right away, because it's very important to get the fundamentals right at the initial stages, and that will happen only in med school, because you will be getting access to these kind of anatomical models and cadavers and so many other things. So the best place for you to consolidate your basics in first year is medical school, where you should consolidate your fundamentals. And that is important, because when you actually start your step 1 prep, the focus will again be on the fundamentals. So it's always going to be about the fundamentals. So it's important that you do it. You begin from the textbooks. Now, when we shift to USMLE prep, I'm sure you have visited the USMLE website, usmle.org. If you go there, you will see that for step 1, pathology, almost 44 to 52% of the questions in step 1 are from pathology, around 25 to 35 from physiology, and around 20% from pharmacology, which means almost 80% of all questions will be from these 3 subjects. So these subjects will do all the heavy weight lifting for your step 1 exam. And I want all of you to really focus on these 3 subjects. In particular, physiology is one subject which students tend to neglect for whatever reason, but unless you have a very, very strong physiology background, you will not be able to get hold of pathology or pathophysiology. So this is perhaps the most important message that I would give in this talk today, that you should focus on these 3 main subjects. And in particular, I am always worried about physiology. And I would encourage all of you to pay very proper attention to physiology. If there is somebody from step 2 CK, the same thing applies for the top 3 subjects, namely medicine, surgery, and pediatrics. They do all the heavy weightlifting. They take up like 80% of all the questions. Now, when you are preparing for your USMLE exams, the way you can become a good test taker is to build or develop the process of algorithmic thinking, which means you should be able to sequentially analyze whatever information you are processing about a disease or about a physiology or a drug, a mechanism or a side effect. So algorithmic thinking, or thinking in the pattern of flow diagrams, is always useful, because you don't have to rote learn. If you know the first point, the starting point, everything else should flow, which is why it is called as a flow diagram. All right, this is an example of a flow diagram. This is for the management of Stemi, which is myocardial infarction, ST segment elevated. So there are a bunch of steps that are to be done sequentially actually. This is exactly the pattern in which a patient of STEMI is managed in the ICU. So instead of rote learning them, you just have to know the first block and then everything else will automatically flow. That's my opinion. Now, this is another example where we talk about the arachnoic acid metabolic pathway in biochemistry, where it divides into the lipoxygenase pathway and the cyclooxygenase pathway. The importance of this pathway is that there are so many drugs that work on this pathway, whether it is xylitol or zafirlukas, montelukast, you have the NSAIDs, you have the prostaglandins and the COX-1, COX-2 inhibitors, you have aspirin right up at the top. So it's important that if you know the entire flow chart, it's very easy to remember the pharmacology part and where they block, what step they block in this cycle. So I would again encourage you to not rote learn, but learn through algorithmic thinking. That will really push your score up by at least 10 points. Okay, it's a process you can cultivate. It's a process you should develop as you go along. The other thing is about problem solving skills. And for that, you need to do what is called as active learning. Active learning is also the same as interactive learning. Rather than just sitting and listening to videos or listening to or reading books, which is very passive, you should be able to interact with something or somebody. And you should be able to solve problems like this jigsaw puzzle. So all medical problems are like jigsaw puzzles where you can actually put the pieces together. Like I have this example where this is a very commonly asked question about parathyroid hormone, the relationship between parathyroid hormone and serum calcium. And we should know what are the different conditions that affect parathyroid hormone metabolism. So there is primary hypoparathyroidism, there is secondary hyperparathyroidism, primary hyperparathyroidism. So each one has its own features, and you can put the pieces like a jigsaw puzzle to solve the question very easily. So this is technique number 2 if you want to become a good test taker. Then we spoke about study buddies. They are definitely beneficial, but I would caution you about choosing the correct one. You don't want to waste time. I have seen students pick good study buddies, apparently good from the outside, but as time goes by, they suddenly lose confidence, they freak out, they become nervous, they become anxious, and so many other issues do crop up. But it's always good to have a study buddy, and the definition of a study buddy is very important. There is a difference between a study buddy and a study companion. You know, you are not going to study half of diabetes and you're allowing the other one to read the other part of diabetes. That's not a study buddy. Study buddy is where both read everything about diabetes and then discuss the difficult areas. So that is a good idea. Now the biggest thing about USMLE versus the other exams that are held, especially in India, you have the NEET PG, where you don't actually require so much of interdisciplinary reasoning. When they move to the next pattern, national exit test, they are actually incorporating a little bit of interdisciplinary reasoning, but still that is very, very primitive. However, USMLE has a very advanced way of interdisciplinary reasoning, and we will see some MCQs, a couple of them, where you will understand that you really have to be you have to be on very high alert all the time to be able to synthesize information from 18 different subjects. You have 18 different subjects. It's a very overwhelming task to assimilate all the information from 18 subjects. And if you really can tackle the process of interdisciplinary reasoning, you can become a master in the process of test taking. That is actually the final goal, which is to acquire mastery over the process of interdisciplinary reasoning. We will quickly go to the anatomy of a question, where I will try to divide the question into different parts as to how you should approach a question. On exam day, I'm sure you are solving questions from UWorld or whatever, but the way you should solve it is very important. So very quickly, I'll read out. We have a 15-year-old male who comes to the family physician with a swelling in the mid shaft of the humerus, associated with low-grade fever and dull pain since 2 months. He is referred to an orthopedic surgeon who biopsies the lesion. Histopathologic examination shows round, monotonous appearing cells with a thin stroma. Genetic analysis shows an 1122 translocation. Now that is a buzzword, as they call it. It's the clincher. This is what clinches the diagnosis. What they're asking though is something else. They're not asking for the diagnosis of this patient. They're asking the classic radiologic features in this condition. Now, the first thing here, therefore, is for you to diagnose the disease, and then you will be able to tell. So this is called as a two-step question. The first step is to diagnose, and the second step is to identify the classic radiologic feature of this. So right now, because everybody is on mute, I would not spend too much time on this. We will come to the diagnosis eventually, but right now I am more concerned about how you will go about dissecting the question. My suggestion to you and recommendation to you is you should look at the last line first. Okay, so you should, this is called as the interrogatory, the question, the lead-in question as it is called. So what are they actually asking you? They're asking you the radiologic feature. So this is exactly what happened when we were reading it out. We thought we were looking at some lesion in the bone which has a particular translocation and blah, blah, blah. We were hoping that they will ask what is the diagnosis, but as it turned out, they're asking for a radiologic feature. So you should know right up front what they want you to know. My second suggestion is the moment you look at the classic radiologic feature as the question, you should also take a very quick look at the answer choices so that you know what to expect in the stem of the question. Once you're done with this, the third step would be to look at the demographics of the patient. By demographics, I mean the age, the gender, the geography, if they're given it. That is always going to be important. Now here you have a young male, 15 years old, and he has a tumor in the humerus, a swelling in the humerus. Now it's going to be a tumor because it has small, round, monotonous appearing cells in a thin stroma. 1122 translocation. Now you should know what are these buzzwords. They are going to give you buzzwords. Buzzwords are those clinchers which will take you to the right diagnosis. As I told you earlier, there is going to be only one correct answer. There is no ambiguity, there is no confusion, just one correct answer. So here, this 1122 corresponds exactly to Ewing's sarcoma. I'm just giving away the answer. So this is a case of Ewing's sarcoma. So the way you approach is that look at the interrogatory, the answer choices, and then finally the vignette or the stem as they call it. Now, this is the sequence. Now the second task is, as I said, you should be able to summarize the key features in the vignette. Now, what are the key features in the vignette? I told you the age of the patient. It's a young male. Where is the lesion? It's in the midshaft of the humerus. Small, round, monotonous appearing cells. Now, this is the buzz phrase, not a buzzword, but a buzz phrase for malignant cells. They will never give you all this information on a platter. They won't say that histopathology shows malignant tumor cells set in a thin stroma. They will say small, round, monotonous. Malignant cells are always monotonous. Cancerous cells are always monotonous looking. And then, of course, the 1122 clinches the diagnosis of Ewing sarcoma, which has a very classic onion skin appearance on radiology. So this is how you should approach any question. So in the vignette, you have to identify the diagnostic hallmarks, pick the correct answer in 1 minute. Now you actually have 90 seconds, which is 1.5 minutes. But I would recommend that you practice solving questions within 1 minute, so that on exam day, your time. The second part is the paraphrasing means marking the salient features of the step. So that's called paraphrasing. That is one of the most important steps by which you can hunt down the core concept. It's all about getting the core concept right, which is to diagnose it as Ewing sarcoma. In case you don't know what this 1122 translocation stands for, you can flag the question. In the exam, there is an option where you can red flag the question and move on. So long as you are in the same block of 40 questions, you can return to the question later. The big advice here is don't anchor yourself. Don't think that, okay, I'm going to remember this. I'm just going to spend another 30 seconds on this question. Don't anchor there. Don't do that. Time is very precious. Just move on. Flag it and move on. You can come back and then solve it again. Now, another important thing here is there are no negative marks. So attempt all the questions. It doesn't matter. If you attempt something, you still have a 50% chance of getting it right, irrespective of what option you choose. So don't allow any questions to go unanswered. Now, the real key is to practice maximum questions. And as I just announced with our Superhit program, we will be solving like more than 10,000 questions, which is a very, very big deal, because I think even good Q banks have like 4,000, 4,500 questions. So we are actually doing a very highly intensive program in the month of May. Now, the other clue that I must tell you about is there are a lot of questions which carry these kind of lab results. So whenever you see a list of lab results, never ignore them. They are always going to have the diagnostic clue in it. Most of the time, the lab values themselves will tell you the final diagnosis. Like in this case, you have a 20-year, again, a young woman who comes with lethargy, abdominal pain, nausea, blah, blah, blah. She has dysuria, polyuria. I'm not spending too much time on this, but you can imagine polyuria, excessive thirst, dysuria. She has tachycardia and dry mucous membranes. But look at the lab results. My attention goes directly to glucose. The blood sugar is like through the roof. It's like almost 700. So she is a diabetic, and at the age of 20, it's going to be type 1 diabetes. And when you have diabetes type 1, if you look at the bicarb, you can quickly know that this is metabolic acidosis, because diabetic ketoacidosis is an anion gap type of metabolic acidosis. Sodium levels are low and blah, blah, blah. But for me, this is enough to get to the correct answer. So you should be able to get hold of these buzzwords and the clinchers, as they call them. So what are they asking? They're asking about something else. They're not asking anything about, say, treatment of, what is the dose of insulin that you will give, or nothing of that sort. They are asking you what happens to potassium levels. So everything is intracellular, everything is mechanistic. It's all about mechanisms of action and stuff. So what happens in diabetes type 1 is very quickly option C is correct, because the potassium is basically an intracellular ion which is pushed out to the extracellular part. So my point here is, whenever you have lab values, the moment you read the interrogatory line, I would want you to focus back on the lab values, because that will definitely contain the diagnostic clue. Now, preparation happens at different levels. There are different types of questions that can be solved, and that is possible only through maximum practice. You should be well versed with the structure and the scores of the exam, which I'm sure you will go through when you read the usmle.org website. Now, time management, as I said, is very important because I want you to practice solving questions within 60 seconds or 1 minute, so that on the day of the exam, you will have some extra time to solve the difficult questions. You should read and you should spend time only on the high yield core concepts, and you should be able to filter out or throw away discard the low yield concepts. Now, there is a lot of confusion about what is high yield and what is low yield. How do you know that something is high yield, and how would you know that something is low yield? This is what my students always ask me. So what I have done is I am going to do another webinar on the 23rd, exactly on this topic, where I will tell you how you can differentiate between high yield versus low yield, because every minute that you spend on solving low yield stuff, you are wasting time completely, and you really don't have time. So that will be a big topic by itself. So I have scheduled it on the 23rd of April. So if you want to sign up, you can do that. It's again a free webinar at the same time, 6 to 7 p.m. Now, I told you that you should develop interdisciplinary reasoning, because questions are really interdisciplinary. And why are they interdisciplinary? Because USA wants you to acquire real clinical mastery. You need to become a good clinician. You cannot just be a theory master. And if you are just a theory master, you won't be able to treat the patients properly. So clinical mastery is everything for the US medical fraternity. And you have to build this. So I have created all these questions, keeping in mind the requirements of the USMLE exam. In addition, some of the things which are often neglected and thought to be very unimportant is that you should have, you should maintain a good physique, which means you should be fit, you should have good nutrition, food, you should have a good positive psychology, you should sleep well. These are very, very important things if you really have to score well. And I cannot overemphasize this, but they are really, really very important. So the study can be divided into 3 main things, and there will be a running thread of spaced repetition. You have to, the part one is to understand core concepts. And I told you that if somebody is in first MBBS, that person should focus on learning the core concepts in medical school. But if you have already finished it, there are other ways to do it. And we are here to help you if you want. And you should never allow even one day to go by without solving at least 40 MCQs. Why 40? 40 is the number of questions you get in one block on exam day. I'm sure in step 1, you know that there are 7 blocks. Each block has 40 questions. So you will be solving like a whopping 280 questions. It's an 8-hour exam. So you have to build stamina as well. So you have to practice MCQs daily. You have to test yourself. There is something called a self-assessment, which you have to do all the time. And then after doing the test, you have to about the existing gaps in your prep, and you need to find your weaknesses, work on them, and rectify the gaps and move forward after refining everything. Now, memory is such a thing that you are going to forget. We have our own tools, and the reason for spaced repetition is that you keep forgetting. So if you review multiple times, if you repeat at specific time intervals, you will be able to recollect more and more as you go by. See, I mean, if on day 1, within 24 hours, you're going to forget almost 80%. So you'll have to keep repeating until you remember most of everything that you have read. Now, this is one of the techniques. I won't dwell too much about this, but if somebody is interested, he can contact me or she can contact me. Now, what is the best way to study? One is, this is what everybody does most of the time. If they are not initiated properly, they will study, they will do revision 1, revision 2, revision 3, and then take a test, which is the wrong method. Some read once, they test again, they test themselves, they don't get the score, and then they study again the test, which is again not the best way. The best way is to study and test yourself again and again and again until you reach your target score, which is going to be like around 250 if it is your NBME test. You should aim to get 250 plus on your NBMEs at least 3 times. There are 5 or 6 NBME tests, and you should get at least 3 scores of 250 plus. Until then, please don't take the exam, because that can be very, very detrimental to your career. Now, what we do at Mendel is we have plenty of practice tests. As I said, we are going to give you, we are going to walk you through like more than 10,000 questions. There will be plenty of practice tests. And we have a very, very, very deep performance analysis that goes and tells you that you are weak in this subject, and not just the subject, but individual topics as well, which you can rectify. There will be course correction measures. There will be a lot of interactions, which is one of the reasons I don't give any pre-recorded videos. And this is the reason why I do live online teaching, because it helps me to interact with the student directly, and it helps the student to talk to me directly. So that's actually, that communication is very important for me, because that has yielded great results all the time. And I want to continue with that type of performance by the students. Now, one of the most neglected areas which helps you actually in becoming a good test taker is to make a timetable and strictly follow it. I have seen the ones who actually match into excellent postings, the winners, they always have a timetable and they always follow it. They never take holidays, they never take vacations for the dedicated period. I mean, in the US, you have a dedicated study period of like 2 months or 3 months, and they refuse to do anything else except focus and ensure that that day's timetable is really finished properly. So statistically, I must tell you that almost 95% of the students in India never follow the timetable they make. They do make timetables, they make them very colorfully, and they do all kinds of stuff, but they never follow it. I mean, they follow it for a week or 2, and then something happens and everything lapses back to normal, which is the worst possible thing that can happen to your performance level. I mean, you would be studying very hard, but if you don't stick to a timetable, you will lose marks. You have to practice extreme discipline. Again, one of the features of the winners, of the best test takers, they follow extreme discipline, like an Olympian or like a champion. You have to be perfect. There is no way you can have even a 1% error in your clinical diagnosis, because you will not get the answer correctly unless you follow the strict discipline. You have to build fitness, stamina, and endurance, both physically as well as mentally, which means you have to practice some kinds of fit. And by stamina in particular, endurance in particular, I want you to also build stamina for 8 hours of taking the exam, because what usually happens is by the time it is like a midpoint in the exam, after 4 hours of concentrating very intently, you tend to lose focus, your eyes become tired, and you stop answering questions that are really very easy correctly. So you need to build stamina. So what I do with my students is when they really start scoring good marks on NBME, I start asking them to take like 5 to 7 blocks of questions, which is almost like exam style. And that happens in the last month before they take the exam, where they are actually practicing like 280 questions every single day. So that builds their stamina and endurance, and that's very important. You definitely don't want to lose marks because of fatigue. When you know the answers, when you know the content, you know everything, you have acquired mastery already, but you don't want to go on that day and feel tired and walk out. So exam mastery is a composite of so many other things. But for me, the one thing that really, really is important is your MCQ solving skills. Now, this is another area which I am always concerned about. And MCQ solving skills are active learning. I mean, your UWorld is one very prime example where you solve MCQs with the help of active learning, which means you interact with the question and you solve them. So this is one skill that you really have to develop very well. As I said, you have to weed out the low yield content. And if you decide to join the Superhit program, I will be dealing exclusively with the high yield content, where you don't have, like I told you right at the beginning, that we have more than 8,000 high yield concepts, and which means I have filtered out more than 40,000 low yield concepts, which is a lot of low yield trash that you don't need for your exams. And you'll get to know about this on the webinar to be held on 23rd of this month. Now, this is something which I have developed on my own. This is what I call as sketch notes. I made a brief mention about this, where I have personally sketched these. Like, I don't know if you are aware of the Weibel Pallidae bodies. This is the endothelium. This is all related to blood clotting, platelet clot formation, where von Willebrand factor is released. And if it grows too long, you have the molecular scissors, which are called as Adam TS13, which chops off the extra von Willebrand factor. So all those kind of things. And this is the arachidonic acid pathway, which I have hand drawn. So the reason for this is another sketch note where I have used the same concept of the molecular scissors, Adam TS13, to help you understand the disease called as TTP, or thrombotic thrombocytopenic purpura. This is the pathophysiology of TTP, where this molecular scissors, Adam TS13, is absent. So what happens is the von Willebrand factor just accumulates and it is loaded with platelets. So it becomes heavy, it breaks and starts floating in the blood. Blood becomes viscous and thrombosis occurs, and all the complications of thrombosis then take place. That is why it is called thrombotic, and it is called thrombocytopenic because all the platelets are consumed by this von Willebrand factor, and it will have a manifestation in the form of purpuric spots. So it's called TTP. So with the help of these diagrams, what I have achieved really is I have taken a lot of feedback from my students, and they have told me that this is the best resource for them for quick revision or rapid revision, especially like a week before the exams. These are like your flashcards, if you will. And you can review even the most complicated topics within less than 60 seconds, less than a minute. So it's better than Anki, because Anki is all about text material. Whereas here it's all visual and diagrammatic. Similarly, this is about platelet disorders. You have von Willebrand disease, Bernard-Soulier disease, Glanzmann thrombasthenia. Everything can be explained in one diagram. You can review this like in less than 30 seconds. Similarly, there are drugs with difficult mechanisms of action like zidovudin, which is an anti-HIV drug. This is a flashcard or a sketch note that tells you everything about zidovudin, its mechanism of action, which is really very, very exciting, very interesting. I mean, if you join my class, you will understand this. But this has a very exciting mechanism of action. Then the second example I have taken is of a drug called as ranolazine, which is an anti-anginal drug. And it is important because it has a very unique mechanism of action. It does not act like the sorbitраtes or the nitroglycerins by vasodilatation or nitric oxide, but here it affects the glucose oxidation pathway, which is really very, very unique. And the USMLE likes to test you on these unusual things. They want you to know these kind of basics rather than knowing the regular run-of-the-mill kind of stuff. Now, this is another example of, these are all examples of my sketch notes, which I provide to my students. This is Menkes disease. I'm sure you must have read it by now, if you have been reading first aid or whatever. This is cat scratch. This is from microbiology. I'll just quickly explain cat scratch, for example. You know, it's caused by cat scratch. And these cats, they harbor this bacteria called as Bartonella henseli, which is going to cause two types of diseases, which means if the person is immune competent, it will have a different pattern of presentation versus a person who is immune compromised and scratched by a cat. So for an immune competent person, he will have regional lymph nodes. I hope you can see the cat scratch marks here. He will have regional lymphadenopathy. And if you biopsy it, you can see a star-shaped abscess. So these are called stellate abscesses or star-shaped abscesses, which are very diagnostic of cat scratch disease. And these organisms, Bartonella, they cannot be stained by regular gram stain. So again, you need a silver stain, which is coincidentally called as Warden starry. So again, a star-shaped, this is a star-shaped abscess, a starry silver stain. So easy to remember if you remember both of them. And the treatment is very, very simple. It's either doxycycline or azithromycin. I have drawn this like a cycle so that you can remember doxycycline. That is the first line of treatment. Well, as in immune compromised people, you have what is called as bacillary angiomatosis, which means the entire body is filled with dilated capillaries and overgrowth of blood vessels, which is very confusing with a patient of Kaposi sarcoma in HIV. However, if you give a good course of doxy plus azithromycin, the patient heals completely. So that is the difference between, I mean, if the patient is immune compromised because of some other condition like tuberculosis or something else. Okay, so again, this takes less than 60 seconds to review, just the perfect way to revise one day prior to the exam. Menkes disease, I have drawn a monkey because it sounds, Menkes sounds like monkeys. And I have this entire story built around that. I don't have time to go through it, but if you join my class, you will be able to find access to all these things. Similarly, you have the phases of acute respiratory distress syndrome the same way. Another big problem with most students is to identify the patterns in histology. Now, this is a case of ARDS. You can see the membranes. These are Samoma bodies. These are giant cells. This is a sarcoid, case of sarcoid. This is a membranoproliferative glomerulonephritis. This is, these are all rods. So this is going to be an acute promyelocytic leukemia. So I conduct very special sessions only on image-based questions, especially histology-based questions, because that is one area where mostly, I think, more than 90% of the students fail to gain confidence even on the day of the exam. So this becomes a very important part of my Superhit program. Conduct a specific webinar, a session on radiology images. And then I have special classes for difficult topics. Acid-base balance is one of the most difficult topics. And again, this is based on student feedback. Shock, water balance, which comes in the form of Darrow-Yannet diagrams. Neuroanatomy, everything is difficult about neuroanatomy. The autonomic nervous system, especially the pharmacology of the ANS, is difficult. Endocrine physiology is difficult, very difficult. Physiology in particular is difficult, and endocrine physiology is all the more difficult. There is something called as arrow questions. I'll show you a very quick slide after this, where the answers are asked in the form of arrows. Then I do special sessions on math-based questions, equation-based questions. Another important thing is about nephrotic and nephritic syndromes. As I said, we do a special session on histology images, radiology images, ECGs, heart sounds, murmurs. There are also a lot of questions on lab-related MCQs. So we do these difficult topics in our special classes. So this is an example of arrow questions where they put a stem like this and the answers are in the form of arrows. These are very, very difficult to for students because there are so many variables. So we conduct special sessions on these arrow questions. And then we have these image-based questions. I'm not going to read this. I did have the intention of going through it, but this is a patient of diabetic nephropathy, and you can see the typical, the classic KW lesion or the Kimmel-Steele-Wilson lesion that is found here. And they have asked about the pathophysiology of non-enzymatic glycosylation. So I won't go through the question per se, but it's a very, very difficult question. This question is really has a difficulty level of 5, which is the highest level of difficulty. This is another question which is very, very difficult. This is actually a question from biochemistry. So these are the MCQs that we walk you through. I am going to, by the way, do a special session on how to solve MCQs. I'll be dealing with like, I don't know, I'll do a 2-hour session only on MCQs, maybe next month, early next month. One of the Saturdays, you should keep looking at the website, and I will announce an MCQ based free webinar next month, and you will enjoy that because I'll be dealing with all the typical USMLE questions. The answer choices, especially with this question, if we had gone through this, all these questions. Now, this is a case of Gardnerella vaginalis, where these are the clue cells, as they call them. And they have described everything related to Gardnerella. But what they have asked is, what is the mechanism of action of the antibiotic that is used to treat Gardnerella? It's metronidazole, and you need to know the mechanism of action of metronidazole, which is that it targets DNA directly. But if you look at the other options, they're equally bad. I mean, they can be very confusing. Topoisomerase 2, ergosterol synthesis, DNA-dependent RNA polymerase, blah, blah, blah. So, so the answer choices can be deceptive. So these exams are designed to get rid of memory masters, people who just rote learn. They will not be able to navigate the questions. So just to reiterate, if you want to be a good test taker, you have to have a good preclinical foundation, and you should also have good clinical decision-making skills. So we come to our program that is coming up, which is the Superhit program. As I said, it's a high-intensity training program of 3 months, starting from May 30 and ending on August 20, where we will be doing more than 8,000 high-yield concepts, more than 10,000 high-yield MCQs. You just saw examples of my sketch notes. We'll have plenty of self-assessment tests with performance analysis, image quizzes, difficult topic webinars, and rapid review sessions. So this is what encompasses the upcoming Superhit program. And as I said, you have the option of choosing between individual subjects and the bundle. Again, I would like to reiterate that you should pick the bundle because you are going to get a very handsome discount of 40,000, right? So, so that's pretty much it. So you have the Superhit bundle where you get a discount of 40,000 plus another 10,000 with the promo code. You can save up to 50,000 rupees. And the earlier you sign up, it's good for you. Okay, so we come to an end of the webinar for today. I am ready to take questions if you have any. Somebody had raised their hand early on. In case I'm not able to answer questions today, you can always email and ask me later on as well. But right now I can take a few questions. Any questions?
Initially, I missed out some points for 5 to 7 minutes.
Okay.
Was it any important thing?
Well, I don't know which 5 minutes you missed.
First 5 minutes, 6 to 7.
Well, everything was short today because it was a short webinar. But I think pretty much in the first part, I actually told a little bit about the same program, the Superhit program. So if you have been present for the second half, then it's pretty much the same thing. And
I also want to add that we recorded this webinar as well, so
Yeah.
you can find it on YouTube if you missed the first half or any part of the webinar in general.
a couple of days it will be uploaded.
Okay, thank you.
Yeah.
That's why.
All right. Yeah. Any other questions?
So I wanted to ask if there is a way to access like a sample syllabus of what you cover and, you know, the timeline of what you cover in these modules. How can I do that?
The sample syllabus is available on the website itself. If you click the tab called Superhit, which is right up on the landing page, it will take you to the syllabus. Not just the syllabus in details, but also the timetable, which is a day-wise breakdown of what we are going to cover. So it will give you a complete 360 degrees view of what is going to happen in the Superhit program. So it's right there in the website. So please go there and access it.
Okay, thank you.
If you have questions, of course, you can write back. You can email ask@mendalacademy.com.
I'll put that in the chat as well.
Yeah, you can put it in the chat. Yes. Any more questions?
Hello, sir.
Yeah.
If I take this course, do I also need to, do I have to buy UWorld and Sketchy also?
Well, this has got nothing to do with UWorld or Sketchy. This is an independent company. So yeah, I mean, if you still want to go, there are plenty of resources, UWorld, Sketchy and Pathoma and Boards and Beyond. So we have got nothing to do with those companies. This is an independent thing, but I can assure you that we are equally effective and more effective. And I can guarantee that whoever attends my Superhit program is going to pass with flying colors. That's what I can guarantee. But it's up to you. It's your personal decision as to what other resources you would want to utilize. Yeah, you will have to buy them separately if that is what you're trying to ask.
I have one query. If I'm going for a Superhit program and not focusing on any other material or any other things,
Yeah.
Will it be sufficient?
Yes, it's a very good question, and I wanted somebody to ask this question. The simplest way to find out is to take an NBME. NBMEs, there are 6 NBMEs which are posted by USMLE itself. So they are the best predictors of your final scores. So after you do my high intensity program, I would encourage you to do an NBME and find out the scores that you are getting. I'm sure you will get superior scores because that is how the entire program is designed. And my material, this is another thing that I need to tell you and everyone who is attending the webinar, that all the lectures that I'll be conducting during the Superhit program will be recorded and they will be available for you on the website. You can come back and listen to it anytime. It will be available for up to 1 year after we start the Superhit bundle. So you can always come back and listen to it. And if you have to review something, if you think you're weak in something, you can do that. But I think the best way to assess yourself would be the NBMEs. Although we will also be conducting self-assessment tests after every subject. But the best way, the gold standard as they call it, I mean, you should use NBMEs because they're meant for that. They are created by USMLE itself. So they are the gold standard. They are the best predictors of your final score. So if you're doing well on NBME, I don't think you have to go anywhere else. The second thing that should happen is if you do high intensity training properly, I don't think you would need any other resource is what I think.
Right. Thank you so much. Thank
Yeah.
you.
Yeah. Anyone else?
Sir, what would you suggest about solving question banks, like doing along with the subject while studying or after that?
It depends on what stage of preparation you are at right now. If you are beginning out, suppose you are just starting, I don't know what stage of preparation you're already at. But for those who are beginning out, I am going to tell all the core concepts. I am going to teach everything. I am going to tell you everything about how the stuff works, the mechanisms, the side effects, everything will be taught to you. So this will be a good way to start instead of starting off with Q banks. But if you are already like, you have been preparing for 6 months, you have done one pass of first aid and half of UWorld and something else, then of course you should continue doing UWorld, which is an excellent Q bank. First aid, of course, everybody has to read. But then this will only accelerate your process of understanding, as well as it will help you really score very, very good marks. And this is not just good enough for your step 1, but it's also equally effective for step 2 and step 3 exams. I have integrated all these 3 syllabuses in one. So you should be able to put yourself in a very, very good position after this.
Okay, thank you, sir.
Yeah.
We have a question from Swati Gupta. She's asking, will you also help in getting clinical rotations?
Well, we don't have an official tie-up yet with anybody who is giving access to clinical rotations, but we can recommend a few of them. I know a few people, we have contacts, but it's not official. I can give you their websites and telephone numbers and stuff, but from there you will have to take it up on by yourself and access them. But yeah, I mean, the ones I will be recommending are really standard people. So yeah, that will be helpful. But it's not official. It's just as a goodwill gesture.
Thank you.
Sir, is there a place where I could access like a sample lecture or something with Superhit or your sketch notes or something like that?
Well, so far as sketch notes are concerned, you just saw a few of them being projected. So that's pretty much how they will look. But if you go to the website again, on the home page, I have posted about 4 sample lectures of that I have recorded, and that will be pretty much the way I will be teaching. And there is one lecture in particular which is related to acute promyelocytic leukemia. It's about that blood cancer, which is completely based on sketch notes. So I think you will have only 2 slides in that entire presentation. It's a very short video, like it's 9 to 10 minutes. So you can access my sketch note videos on the home page. And I would recommend that you look up the acute promyelocytic leukemia video in particular if you want to test the concepts of sketch notes and their effectiveness.
Okay, thank you.
Hello, sir. The help which we are receiving, sorry, the classes and everything, is it only for step 1 or do you also offer
No,
for
right
step
now,
2 and
yeah,
3?
that's a good question. Right now, the one that is starting from May 30 and which will be ending in August 20 is for step 1. We will be starting another high intensity training program for step 2 CK, maybe in October. So that will be October, November, and December for step 2 CK. Are you right now a student for step 2 CK? I think it was Fayaz who was asking me this question.
No, sir, I'm still in step 1, but I was just curious about the 2 and 3.
No. This will happen and then it will be followed by step 2. And then again, there will be a third cycle of step 1. So it will continue rolling all the time, one after the other.
Thank you, sir.
Yeah.
We have another question in the chat. It's by Vivin. He's asking, will the lectures be taken subject-wise or system-wise?
Yes, if you go to the website, you can see that they are subject-wise. The reason I have chosen not to go system-wise, although that is more popular right now, is because when I used to teach system-wise, just for your information. But once I started teaching them say cardiology or something, they could guess the answers because they would know that this is from the cardiovascular system. So smart students, they can guess certain answers. While as when we go subject wise, it's difficult to guess what subject it is coming from, what topic it is coming from. So this is a more rigorous method and it's more random, because if you take up say pathology, one question would be from the respiratory system, the second one would be from the renal, and the third would be from endocrine. So it's impossible for students to make some intelligent guesses and come to the correct answer, which is the problem with going system wise. I have no issues going system wise, but I found that the scores were going down even with the best of students, because unconsciously, subconsciously, they do tend to make intelligent guesses, which is not good for their scores. So the superhit bundle basically has tried to avoid those pitfalls and make it more foolproof as possible. So yes, the answer is we are going subject wise, and it's on the website. If you go to the home page, you'll get it.
Sorry, we have another question from Stalin Ramprakash. He's asking, sir, how many hours would we be getting every day with the superhit bundle, and how many hours should we be putting into it to make it effective?
Good question, Stalin. I will be conducting classes for 4 hours. It's high intensity, isn't it? So we have to work harder, and it's a 3-month program. There's just so much of material that I need to cover, and so many MCQs that need to be solved. It's going to be a long session, 4 hours per day, but there will be a break after every subject. It depends on if you are a post-intern, that you have the entire day for you, the remaining hours where you can review all the material, because as I said, my videos will be recorded, they will be present, available on the website. You can come back and listen to whatever videos you want and brush up on stuff that you're weak in, and you will have plenty of time. I don't know, are you a post-intern, Stalin? What is your current this thing?
First year right now, so I was wondering how I'll be able to factor 4 hours into my normal classes as well.
Yeah, you are a first year student, you said. Yeah, so the timing of the superhit is from 5 p.m. to 9 p.m. And that has been done deliberately to accommodate students who finish college and come and attend classes. Most of the students, they are done by then, and I'm sure That's one thing, but yeah, I mean, we can't delay it further, because if I conduct classes from 6 to 10, then students tend to get tired. These are very, very intense programs. So I need full attention and focus from the students as well. So this was the best time. And again, I asked my students to vote as to what would be the best time. It's also important for me to start from 5 p.m. to 9 p.m., which is the time to accommodate international students, because that is the morning time in USA. It's about 7:30 a.m. in the US. So students who want to log in from the US also recommended that this should be the time. Yeah, it might be difficult if your colleges extend beyond 5 p.m., but you can't go beyond that. I cannot go later than that, because the end will be like after 10. It will especially affect students who live in hostels, because they get dinner up to a particular point of time and stuff. Yeah, it might be inconvenient, but yeah, I really cannot solve that problem for you.
Yeah. Thank you, sir.
Yeah.
We have another question from Swati Gupta. She's asking also, are clinical rotations compulsory?
Yes, nowadays, okay, USMLE is not, and it has never been just about passing the 3 exams. It's about building CV. You need to build CV. You have to do 3 clinical rotations in the US, not in India, in the US. You have to do 1 month programs, three of them. You have to get involved in some kind of clinical research if you can. If you are in a college and you have access to some good teachers, try to get hold of like at least 2 to 3 publications before you apply for residency programs, because it's all about building CV. It's not, they will never just give you residency programs on the basis of your exam scores. They will expect you to do some volunteering work with NGOs in the US. So they want a fully developed personality, you know, who has empathy for the patients, and who can treat well, clinically well oriented, who has good experience and all those kind of things. So the answer is yes, you will need 3 clinical rotations of 1 month each. Start building your CV. My advice is the longest time is required for publications. So if you can go and talk to your clinical bosses, they should be able to help you. Go and meet those teachers and professors who are interested in publishing, and they will be more than happy to help you.
Thank you. I do see that we're running significantly over, so we'll take 2 more questions. If not, as we mentioned, you can always email us at ask@mendalacademy.com. As a reminder, we do have another webinar coming up on April 23rd, so I urge you guys to sign up and enroll for that as well. Secondly, you can find all of the information about the Superhit bundle as well as the individual subjects and courses on our website. So please feel free to go take a look at it and email us with questions if you have any. Just as closing remarks, I do want to thank our Mendel team for putting so much effort into this webinar and making this possible. So just shout outs to Hari, Krishnan, Sundar, and Kavita for making this possible. And yeah, I hope you guys enjoyed the webinar today, and we look forward to hearing from you soon and seeing you in the Superhit program.
All right. So good luck, everyone, and hope to see you back in the second webinar very soon.